Welcome to Confessions of a Doctor with your host, Dr. Emma Petcho.
Hey everyone, I'm Dr. Emma Petcho here. I am so excited that we are starting this podcast. It's been a while in the making, but like I said, I'm Dr. Emma Petcho. I'm a board certified and licensed naturopathic physician and an integrative medicine expert. And this is our podcast, Confessions of a Doctor. I'm here with my fabulous producer Alex.
Hello, everyone.
Who kind of keeps me on track and makes sure that we cover all the things that we're here to cover. But I just want to first, before we get into it today, just introduce a little bit about what this podcast is about. Confessions of a Doctor is a health education podcast where I, as a naturopathic physician and integrative medicine expert, share my expertise in the field. We have several different segments that you'll see over the course of the next few weeks where I break down common health complaints, debunk health myths and clickbait that you might read, and review medications and supplements, as well as answer your listener questions. A little bit more about me. Besides being a doctor, I'm also an American College of Sports Medicine certified personal trainer, an instructor, a faculty instructor of biology and health sciences at a local university, and I'm the CEO of my own health education company, Empower You Health and Wellness. And so I'm here today to break down some health stuff, so let's get into it. We're back. A big part of Confessions of a Doctor podcast is our segments. And one of my favorite segments is when I get to teach about a topic, especially from a naturopathic or an integrative medicine lens. Because as a naturopathic physician, a lot of what I do is educate patients on their own health, their own body, and how they can empower themselves to really take their own health into their hands. So our first segment, producer Alex, what is our first segment of the day?
The first segment we'll be talking about is Some Like It Taut.
Some Like It Taut. Oh my gosh, this is one of my favorite segments that we do. Some Like It Taut is literally where I will break down a health topic, one that I see in my clinical practice or one that commonly comes in, and we'll break it down as a medical condition, symptoms that you might see, how it's diagnosed, maybe workup steps that might happen in a physician's office, and some conventional and alternative treatments. So we'll get into it today. Our Some Like It Taut topic for today is circadian rhythm sleep disorder, which I'm going to abbreviate CRSD because that's kind of a mouthful. Would you agree, producer?
Yes, I would agree.
Totally. So CRSD, or circadian rhythm sleep disorder, is a very common sleep condition that comes into my office all the time. Just the other day, actually, I was seeing a patient who has been suffering for this for over 10 years. And the issue with this health condition is there's not a lot of great conventional medical therapies to treat it, but luckily for us, there's tons of naturopathic ways that we can address circadian rhythm sleep disorder. So let me paint you a picture, okay? All right, so you go to bed at night, you fall asleep just fine, no issues. Then around between like 1 and 4 in the morning, you wake up from sleep, you're wide awake, you're ready to go. It's like it's 6 or 7 in the morning, except for it's in the middle of the night. You then try to fall back asleep, you do all the things, go to the bathroom, drink some tea, put on some, relaxing music or white noise. But regardless, it takes you, half an hour or hours to fall back asleep. You then finally fall back asleep only to then just be woken up by your alarm. And the rest of the day, you're feeling tired, sluggish, maybe a little brain foggy, having a hard time concentrating, and it just throws off the rest of your day. I know I've experienced this before. I know a lot of patients that I see experience this, and they don't really have a name for it. I don't know, have you experienced this before?
I definitely have.
Totally. It's super common. And so circadian rhythm sleep disorder is something where your body's own rhythm, which is called the circadian rhythm, gets thrown out of whack. And I don't know if y'all have heard of circadian rhythm before, so I'm going to kind of get into the science behind it, because I am a teacher as well as a doctor, so I get a little nerdy. So what happens with your circadian rhythm, when you go to sleep at night, your body produces this hormone called melatonin. Melatonin helps you fall asleep naturally, and it keeps you asleep at night. Some people even take supplemental melatonin to help them fall asleep. In circadian rhythm sleep disorder, your normal nighttime melatonin level is completely okay. Then when you're sleeping, sometime throughout the night, your melatonin level starts to decrease. And then what happens is this sneaky hormone called cortisol, which is the stress hormone in your body, which wakes you from sleep in the morning, starts to increase. And when that starts to increase in the middle of the night, it can wake you from your sleep, and it can prevent you from getting back to sleep. So it's an imbalance of melatonin and cortisol that really throws this rhythm out of whack. And so part of how we work on addressing this is promoting your own body's natural melatonin stores, as well as decreasing your cortisol level in the morning. And so we'll get into kind of treatments and management here in a minute, but that's really what's going on behind the scenes with your cells in your body when you're trying to go to sleep but are staying awake at night, especially waking up in the morning in weird times. Some things that you need to make sure you rule out are other sleep disorders or sleep conditions. Things like sleep apnea, where you're maybe waking from nighttime, trying to breathe, having trouble breathing at night. Other sleep conditions where maybe you're having issues falling asleep initially, or things like anxiety or other mental health conditions that can also affect your sleep. Also, other hormones, other metabolic processes, if you have low blood sugar. So there's tons of things to look into. So definitely if you wake from sleep at night, don't just jump to, oh my gosh, I have CRSD. But it definitely is really common, relatively common for my patients. And it's pretty easy to diagnose. If you go into a doctor's office, typically what they'll do is they'll ask you a bunch of questions about your sleep history. They might ask you to complete a sleep diary where you write down when you go to bed, when you're waking up in the middle of the night, and when you wake up the next morning. And then they may or may not recommend doing some type of lab testing, depending on what your history is and what your personal picture is. From there, based on the sleep pattern that you have, they'll give you this diagnosis. So let's say now that you've seen your doctor, you've done your sleep diary, and they said, yes, this does seem consistent with circadian rhythm sleep disorder. Some people will even call it shift worker disorder or shift work sleep disorder, because it's really common in people who have to change sleep schedules from working late night shifts or overnight shifts. So you see this a lot in healthcare and many other industries. But so let's say you have this diagnosis. What are some things you can do to fix it? Because that's a real big piece here, right? Like, okay, I have it, but how do I fix it? Conventionally, when you're going to see, your regular doctor, the conventional way of addressing this would just be from a sleep aid. So taking a medication of some type, a sleep medication. While this can be helpful in sleep onset, which sleep onset is falling asleep, helping you fall asleep at night initially. So a sleep aid may help you with your sleep onset, fall asleep faster. It's not going to help with sleep duration or how long you stay asleep. So you'll still find yourself waking up in the middle of the night. And some of these sleep aids conventionally can be addictive and have other side effects. You just have to be cautious, especially if you don't need them. If you're falling asleep fine at night, why take something that you don't need? So what I tend to recommend is something that's going to really address that underlying cause, because as a naturopathic physician, that's what it's all about, is trying to get to that root cause of the problem and fix things at its source. So we talked about circadian rhythm sleep disorder as being an issue with your circadian rhythm. That makes sense. So we're going to address it from that way. So what I like to do with patients is we'll talk about using microdosing of melatonin, so typically less than 1 gram of melatonin, and I'll have patients start taking this about 5 hours before you want to go to bed. So producer Alex, when do you typically like to go to bed?
9:30 p.m.
9:30 p.m. Okay, so if we're going to go to bed at 9:30 p.m., we're going to microdose our melatonin at 4:30 p.m. So 5 hours prior to that time, which seems super early, but you're taking a really small amount. What that does is it nudges your body to make more of its own melatonin. So by the time you want to fall asleep at 9:30, you have a nice, healthy amount of melatonin circulating. You're able to fall asleep just fine. Higher levels of melatonin suppress cortisol, which then can help you stay asleep throughout the night. That in itself can help fix this problem, but it typically takes like 3 to 6 months on its own. So I like to address the morning time wake up as well. So then in the morning when you get out of bed, let's say that you fall asleep at 9:30 p.m. and you need to get up by 7 a.m. At 7 a.m. when you get up, I recommend using some type of happy light in the morning. Now, some of you might have those alarms. I know I have one that kind of gives a gradual sunrise in the morning. That can be really great, but you still will need to use a 10,000 lux light that mimics sunlight, as in the form to stimulate your own vitamin D production. That's what these happy lights, quote unquote, you can't see me, but I'm making air quotes. These happy lights do is they give you a 10,000 lux light, which really actually stimulates to your body vitamin D and sunlight. And this can help you produce that morning burst of cortisol that can get you up and out of bed and make you not have to click snooze on your alarm for like 5 times, which is me some mornings before coffee. You can ask producer Alex. He will agree.
Yes, I will.
Absolutely. So anyway, so you do your microdosing of melatonin 5 hours before sleep. You wake up the next day. You do your 10 minutes of a happy light in the morning. And then you have this balance. And you repeat this. You need to have it on repeat. And you need to make it a rhythm. Doing this for, several weeks, I've seen this alone fix the circadian rhythm sleep disorder. But for some people, it's not enough, right? Every person's different. So if I'm still seeing a patient and we've been trying this for a couple weeks and still are struggling to kind of refix or readjust the circadian rhythm, or we're still having nighttime wake-ups, then I'll also look at what is something I can do to suppress nighttime cortisol. One of my favorite things that I've seen studied that has been studied to decrease nighttime cortisol is using something called phosphatidylserine. And phosphatidylserine actually has been studied to decrease cortisol levels in both females and males by several different points. So typical cortisol levels anywhere from like 10 to 20, depending on the time of day. And so it can decrease your cortisol level by 5 points over the course of 2 to 3 months. And I'll link the study on my website and page, so if you're interested in reading it further. But so sometimes I'll do a phosphatidylserine dose at night before bed to just help nudge that cortisol in the right direction, and those two in combination can often help. Now, there's many other things you can try. There's tons of different ways that we can produce or boost our own melatonin stores, that we can decrease our own cortisol levels. And there's also a lot of different systems in the body that can affect both those things. So obviously check with your doctor, or, you can definitely ask me, and we can have this as one of our segments in the future of other ways to do this. But these are my 2 favorite ways to come at this super common condition. So I think that's all. What do you think, Producer Alex? Do you think we covered it?
That was some great information.
Awesome. Well, if you have more questions or if you have conditions that you want me to deep dive on, feel free to reach out. We'll have some places where you can submit your own medical conditions or common symptoms to Some Like It Taught, and they might be featured on a future episode of Confessions of a Doctor. Before we get into the confessions of the day, here is a brief note from our sponsor.
This podcast is sponsored by Empower You Health and Wellness, a health education company. Empower, educate, inspire. Check out www.empoweryouhealthandwellness.com to learn more about how to revamp your health and change your life.
Welcome back to Confessions of a Doctor. I'm your host, Dr. Emma Petshow, and I'm here with producer Alex.
Hello, everyone.
And our next segment is also one of my favorite. I think they're all my favorite, but this one is great because we really get to delve into topics that you send in to us. And get to do some reviews, because I feel like a lot of times there's a lot of weird information out there. And that's part of the whole point of Confessions, is to give you the real scoop or the tea on these different supplements or articles that y'all want us to look into further. So our next segment is called what? What's our next segment, producer Alex?
The next section is called Poppin' Pills.
Poppin' pills. Oh my gosh, this is great. Okay, poppin' pills. Every week, we're going to take a medication or a supplement, either one that y'all have sent in for us to look into, or one that I personally have used or recommended to patients before in the past. And we're going to delve deep into, is this a supplement that we should recommend, or is this a supplement that maybe we should pass on? And I think it's really important to do this, because the FDA, I don't know if y'all know this, but the FDA does not actually regulate the supplement industry. There's some things that are put in place to help keep consumers safe, but there's no actual official FDA regulation of supplements. So in theory, companies could put whatever they want into a pill and market it however they'd like, and that would be legal. Isn't that insane, producer Alex?
That is really insane.
It's just crazy. It blows my mind. So knowing what supplements are safe and what supplements are trash is super important. And as a doctor, as a naturopathic doctor, a lot of times we are addressing things using supplements or alternative medicine. And so a big part of my job is to review these things to make sure what I'm recommending is safe and actually effective for patients. What we'll do every week is I'm going to review 4 different categories for these supplements. The categories that we'll review are ingredients that are actually active ingredients, so doing the health job of the supplement; fillers, so other stuff, good and bad, that they put in that supplement; the company as a whole, and what evidence is out there for the use of that supplement, either that supplement in particular or medication, or maybe the active ingredients if there's no actual studies on the supplement itself. We'll then give the supplement or medication a pill rating, which will be out of 5 pills. And so that will be a good guidepost of what supplements are good that we should recommend or would be safe or beneficial to take, and maybe what supplements we should pass on. Right? And let me tell you, it's hard to get a 5 out of 5 pill rating. So anything that's above a 3.5 it's pretty good pill rating. Anything above a 4 is like great. 4.5 is like all-star. So that's going to be how we rate these things moving into the future. So are you ready to get into it, producer Alex?
I'm ready.
Okay. This supplement is one that I actually personally have taken myself. I recommend it to a lot of my patients. It's called Alka Calm, and it's a supplement by Professional Formulas. That's the supplement company. Alka Calm is a powdered supplement that's added to water with the goal of drinking it 1 to 2 times daily, according to the package. I personally use it, so I do have a little bit of dog in the fight, although I was really interested in seeing, how this rated on our pill rating scale. I do know the benefits personally of magnesium, and so that's a big part of what this supplement contains is magnesium, and it's often recommended for things like sleep, anxiety, muscle cramps, and more, which we'll get into it. So what are some of the active ingredients? I know y'all want to know. So active ingredients in Alka Calm include magnesium in the form of malate, citrate, ascorbate, and lactate. So there's 4 different types of magnesium in this one supplement at 200 milligrams, which is about the steady dose that I tend to recommend people start at. There's also potassium, which is another electrolyte, another mineral that's in there at 150 milligrams. There's a teensy tiny little bit of vitamin B2, which is riboflavin. And there's pretty small amount, honestly, of vitamin C. That's 75 milligrams. So these are the 4 active ingredients in this supplement. And if I'm looking at this supplement as a magnesium supplement itself, the fact that one dose contains 200 milligrams, which is typically a starter dose, I think it is pretty good. So that's a decent active ingredient list. When we get to the additives, they do have a thing on there that says it's vegetarian, gluten-free, and hypoallergenic, which is helpful, but does that mean anything? I don't know. So some of the additives include things that are relatively common, like citric acid and aspartic acid. So what are those things? So citric acid is a compound. It's a molecule, and it's colorless. It's an organic acid, and it's naturally occurring in citrus fruits, things like lemons, oranges, etc. It is pretty common in the body. It doesn't have really any adverse health effects, besides maybe if you're not really good with acidic foods, it might upset your stomach. But overall, relatively benign additive. Aspartic acid is actually a non-essential amino acid, and amino acids are like building blocks of your proteins in your body. Non-essential means our bodies produce it on its own, so we don't have to get it from our diet, but it's not harmful to intake. So both of those additives are completely fine in my book. They pass the additives test. They're not harmful, they're relatively common. Other additives that are totally fine is lemon powder, other flavors like raspberry, lemon, and lime, raspberry fruit powders, stevia, which is a sweetener. So those are normal additives that I also don't really find any harm with. The other two additives that are a little questionable is silicone dioxide and maltodextrin. Have you heard of either of those, producer Alex?
I've never heard of them.
Yeah, so I did a little deep dive. So silicone dioxide is kind of like silica. And what silicon dioxide does is essentially allows a powder to stay a powder. Because when we have a powder, it wants to clump together. And so silicone dioxide prevents that from happening. It's like an anti-caking agent. It's often in like spices or creamers. So if you have powdered creamer, it's often you'll see silicone dioxide there. So it's safe in small amounts, but if you inhale it or eat it in large quantities, it's dangerous. So I would say while I don't love having this additive in here, it makes sense why, because it's a powder. So that's why it's present in this supplement. And I think in a small amount, it's probably safe. And then maltodextrin was the last one that I was like, what does this mean? And maltodextrin is essentially a sugar that's chemically created from either corn, rice, or potato. It can be made from wheat, but since they said that this is a gluten-free supplement, I'm assuming it's not made from wheat. So it's from corn, rice, or potato. We don't know the source. It can be safe, but some people who have an allergy to corn, rice, or potato might not be able to tolerate maltodextrin. So in some cases, it can cause an allergic reaction or it can cause a skin irritation. So if someone did not tolerate this well, I bet you money it'd be from the maltodextrin, which I don't necessarily think is necessary given that stevia is there as a sweetener. I think overall, we're looking at additives. Okay, nothing terrible, but nothing super great either. So before we get into the company, when we're talking about Alka, we also want to think about what studies and evidence is there for indications. So when we think of the purpose of the supplement, we're looking at magnesium and really potassium. Magnesium can be good for insomnia or sleep. And there's actually some good evidence via some clinical trials that magnesium can help with sleep onset, which we talked about earlier. So it can help you fall asleep faster and duration, help you stay asleep longer. And 200 milligrams can be used for this, which would be 1 scoop of this supplement. So there's some pretty good evidence there. It also can be used for anxiety and depression. There's good evidence, like a B rating of evidence, which is pretty high in the evidence scale. And the only thing that prevented it from being even better for anxiety is that it hasn't been studied for that long. So we just need to study it for longer. The other thing that I think is really cool, because a lot of my patients come in with high blood pressure or issues with their heart racing, is that magnesium can help decrease heart rate, and it can also help with high blood pressure or hypertension. And there's been a study that lowers your blood pressure by 5 to 10 points from taking magnesium. That's huge considering a lot of medications do the same thing, but with more side effects. So really good evidence for kind of these first 3 areas, like heart protection and blood pressure, anxiety, and sleep. So to me, I think it can be really beneficial. The one that I was surprised about is, I don't know if you're an athlete, producer Alex. Have you ever been told to take magnesium after a workout to help like relax your tight muscles?
Yes, I have.
Yeah, so have I. I was a track athlete in college and I coached track athletes, and I've often even said like, hey, take some magnesium or take some potassium in food form, and that can help with muscle cramping and exercise recovery. When I looked into the evidence on this, studies are kind of mixed, and there's confusion on, does magnesium actually help with cramping, or is it a placebo effect? Which shocked me, because I hear this super common, especially in fitness studies or fitness circles. So I would say, although the supplement is useful in some ways, I wouldn't necessarily use it for post-recovery or muscle cramps at this point. I think the evidence is still a little bit mixed, although with the supplement, there's some potassium in there. And potassium has been studied to help with dehydration, and muscle cramping due to dehydration. So it might not be a terrible option. I'm just not 100% convinced on that indication. Lastly, our last little area for our pill Poppin or Poppin pills rating, our pill rating is looking into the company. So the company is Professional Formulas. This is actually an Oregon-based company, which is where we are hosting our podcast right now. Woo woo, West Coast. And the supplements are manufactured locally, which is nice. I looked into the company to see if they have any national certifications. There's a couple different certifications that can help decide if the company is using good manufacturing practices and are actually having third-party testing. And Professional Formula is NSF certified, which means that their products are impartially reviewed, their labeling and claims are objectively verified by a third party, not the company itself. And it's a GMP, a Good Manufacturer Practices compliant facility. So it has been inspected by the FDA, which is fantastic. And you can find this listing online. While I couldn't find studies on the supplement itself, I could find studies on the ingredients. So I'd say overall, the company has some pretty good evidence and some pretty good practices. Producer Alex, are you ready for our first official pill rating?
I am completely ready.
I'm so excited for this. So our first pill rating for Alka by Professional Formulas, it gets a 4.5 pill score for ingredients, which is pretty high, I have to say. It's pretty tough, but some good ingredients. For fillers, it gets a 4 pill rating because it does have some, it has some weird stuff in there with fillers. The company itself, Professional Formulas, they have good manufacturing practices. So it gets a 4.5 pill rating for the company itself. And the evidence, while there was some really strong evidence, there was no evidence actually studying this supplement, Alka. So the evidence rating got brought down a little lower to 3.5 pills. So overall, our first official pill rating for Alka is going to be 4.125 pills. Which is pretty good. So congratulations, Alka by Professional Formulas. You've officially made it into the 4.0 and above club. That's our first Poppin' Pills segment. We will be back after a few short messages. We are back to Confessions of a Doctor with your host, me, Dr. Emma Petcho, and my wonderful producer Alex.
Hello, everyone.
We are so excited to be here again, our first inaugural episode as a podcast. We thank you for listening so far. I hope it's been helpful. We've gone through some like it taught. We've talked about Poppin' Pills with Alka and gave our first official pill rating. And our last segment here really is all about you all, the listeners. And our last segment is Ask Dr. Emma Your Dilemma. And this segment is all about what questions do you want me to ask coming to me as a naturopathic doctor, a health educator, a faculty person, a personal trainer, whatever lens or hat you want me to wear. Your questions, you ask them and they will be answered. So our first question of our first episode, what's our question, Producer Alex?
The question of the day today is, what is naturopathic medicine?
What is naturopathic medicine? That's such a great question. I get asked this all the time as a naturopathic doctor. And so I'm super happy to answer it and kind of get to the nitty gritty of what it is that I do. So naturopathic medicine is a view of medicine. Really, the theory behind it is using a holistic approach to treat disease and dysfunction using the most natural modalities as possible over more modalities that maybe would cause more risk or more injury. So that's the purpose of naturopathic medicine. We use 6 different principles to kind of help guide our medicine and our practices. And so those principles are prevention. So as a naturopathic doctor, I really try to focus on preventing illness, preventing disease, doing all of your screening recommendations for things like cancer or chronic disease or illness, even things like vaccinations when appropriate, good healthy diet, good exercise, all of your good preventative public health mediums are included in that principle. Another principle is the healing power of nature, which I know when I say it, Producer Alex, when I say that, I'm sure you think like, oh, woo, healing power of nature. Am I right?
That's the first thing I think of.
Totally. And most people are like, healing power of nature, what the heck do you mean? When I think of healing power of nature, what I'm thinking about is, I'll give you a little scenario. When you get a paper cut, you cut your finger. You might, notice it bleeds a little bit. You might put a little pressure. You might wash it with some soap and water. But then most of the time, you forget about it. And a couple days go by and you'll look at your finger and your paper cut's healed. your body has an innate ability to try to heal itself. It wants to move back to what we call homeostasis or equilibrium, which is this balanced state within the body. Your body is striving to always move back to this state. I'm teaching biochemistry right now, and literally we always talk about moving back into homeostasis or balance. So the healing power of nature is really just that. It's the body trying to heal itself. Most of the time, we can kind of nudge the body in the right direction. Sometimes we really got to take control. If the body's really gotten out of whack, if there's a lot of dysfunction or disease, we need to put things in place to help move that body back to homeostasis. So that's the healing power of nature. A couple other principles are identify and treat the cause and treat the whole person. Identify and treat the cause is really, we're trying to figure out that underlying cause of disease and dysfunction. So when we talked about Some Like It Taught today, when we looked at why is someone waking up in the middle of the night, we didn't just look at, oh, maybe their sleep schedule's off. We looked at that circadian rhythm, and we looked at the hormones involved in the circadian rhythm. That's getting to the underlying cause and treating and addressing the hormonal imbalance versus just trying to help someone sleep through the night by putting a Band-Aid approach to it. When we think about treating the whole person, we think of the whole person as the physical, spiritual, emotional, social, all aspects of a human. So we're not just treating one part. We're not just replacing a part like a car, like a mechanic for a car. We're really addressing the whole body because the whole body is interconnected. And my favorite principle is docere, which docere is the principle of doctor as teacher. And obviously, as a faculty member and a teacher in science, a health educator, I am passionate about education. And that's part of why I started this podcast and my company, Empower You, because I wanted to bring health education to the masses, not just to my patients. My patients often say that naturopathic medicine is the best kept secret. And I feel like it should not be kept a secret, as many people who want to have access to theories and reasoning behind a naturopathic physician or an approach to naturopathic medicine should have access to that stuff. And the last principle, which is the most important principle in my opinion, is first, do no harm, which is a principle that's universal for all areas of medicine. As doctors, we don't want to harm our patients. We want to help our patients. And so first, do no harm is really trying to use the most low-risk treatment modality possible, and then working our way up from there. So that's a little bit behind the theory of naturopathic doctors. Some treatment modalities that we study in school that may be different than ones that you're used to when seeing your normal physician. We learn pharmaceutical medications, and I can prescribe pharmaceutical medicines, and I manage lots of medications in my practice. We're also trained in immunizations, both vaccinations as well as things like injection therapy with vitamins and minerals, and we're trained in IV therapy. We're trained in things like herbal medicine and supplementation, so supplementing with nutrients or herbs as medicine, energetic medicine using things like homeopathy or combination homeopathics, physical medicine modalities like chiropractic care and physical therapy exercises, as well as diet and exercise. We have literally so many different treatment modalities available. It's insane. I mean, it seems like we have really a lot of great tools in our tool bag. And so that's what I like to say to my patients. I have a ton of tools in my tool bag to help you get the best care possible. So what are some differences in training? Naturopathic physicians attend a 4-year accredited medical school. We also take 2 board exams called the NPLEX and 3 clinical exams that we have to pass to become licensed physicians. We take classes like biochemistry, microbiology, pathology, physiology, pretty much any ology you could think of, we've taken it, as well as more specialized classes like herbal medicine and physical medicine and some of those modalities that I talked about. We also take over 2 years of nutrition, so we're really well-versed in nutrition therapy and can talk about dietary adjustments and food medicine, which I think is a really big part of what I do in my everyday practice. Some things you should know, though, about naturopathic medicine and naturopathic physicians. Naturopathic physicians are not licensed in all 50 states. So right now we're licensed in about half the states in the United States and about half the provinces in Canada. And you can actually get an updated list by going to the AANP, which is our national organization, by going to www.naturopathic.org. That's naturopathic.org. And you can get an updated list of where naturopathic doctors are licensed and regulated. Why is that important for you? Well, if you're looking for a naturopathic physician, If you go to a state like Oregon or Washington, where I practice, you'll find that naturopathic physicians are practicing as primary care providers. So I am, most of my patients, PCP, meaning I prescribe their medicines, I do their basic checkups and exams, and then we also talk about all the wonderful naturopathic modalities too when it comes to treating illness or dysfunction. If you go to a state like California, naturopathic physicians are also licensed and regulated, meaning they have to pass their licensure exams, they have to be licensed within the state, but they can't prescribe pharmaceutical prescriptions. They can do IV therapy. They can treat you with natural remedies. So there's difference though in what we call scope in California. This is the same with many different states. You would want to know how are naturopathic physicians licensed and regulated in your state. And then some states are completely not regulated. States like Texas, where my partner's from, his state does not license naturopathic physicians, which means that there are naturopathic doctors there. They're just practicing not as a physician, but as more of a health consultant, where they can still talk to you about these different health concerns, provide recommendations from a naturopathic lens. But the caveat there is that you do not have to actually graduate from an accredited naturopathic medical school to say you're a naturopathic practitioner in Texas, because it's unlicensed and unregulated. So my caveat for you is, before you see a naturopathic physician, definitely look into their education, see if they're licensed. You can ask where they've gone to school. You can check what their background in education and training is. And naturopathic doctors that are licensed and regulated, like myself and board certified, would be happy to share that information with you. So just make sure you stay educated. Go to organizations like the AANP, state organizations like the OANP in Oregon, or the AANMC. All these organizations can help give you that up-to-date info. So that's your first Ask Dr. Emma the Dilemma. I'm so glad I got to answer it for you, and hopefully I gave you a little insight into what I do as a naturopathic doctor, my training, my scope. We'll definitely get into more of your listener questions. If you have more questions for me, feel free to comment, or we'll also post a link every week where you can add your own questions into our Confessions of a Doctor. So you may be featured in an Ask Dr. Emma the Dilemma segment in the future. Well, we've made it to the end of our episode. We covered so much today in our first episode of Confessions of a Doctor. We went through a Some Like It's Hot for our circadian rhythm sleep disorder. We did our first official Poppin pills rating of Alka Calm, where we got to rate Alka Calm with its first official pill rating of 4.125. And then we finished it up with one of your listener questions with our segment on Ask Dr. Emma Your Dilemma. I have to say thank you so much for listening, for tuning in. Please rate us, download us, subscribe where all your podcasts are, wherever you listen to your podcasts. You can follow us on Instagram at Confessions of a Doctor. You can also follow me personally on Instagram, TikTok, or any of your socials at Dr. Emma Pet Show or Empower You Health and Wellness. For any further health and wellness information, you can also head over to my website, www.dremmapetshow.com. That's DREMMAPETSHOW. Yes, pet show, like you're going to see a pet show. And no, I'm not a veterinarian. That's all for today. Thanks so much, and we'll see you next week.
This podcast represents the opinions of Dr. Emma Pet Show and her guests of the show. The content here should not be taken as medical advice. The content here is for informational and educational purposes only. Each person is unique, so consult your healthcare professional for any personal medical questions. Views and opinions expressed in the podcast are our own. While we make every effort to ensure that the information we are sharing is accurate, we welcome any comments, suggestions, or correction of errors. Privacy is of utmost importance to us. All people, places, and scenarios mentioned in the podcast have been changed to protect patient confidentiality. This podcast should not be used in any legal capacity whatsoever, including but not limited to establishing standard of care in a legal sense, or as a basis for expert witness testimony. No guarantee is given regarding the accuracy of any statements or opinions made on the podcast. In no way does listening, reading, emailing, or interacting on social media with our content establish a doctor-patient relationship.